it's easiest to understand through examples, and I'm happy to share a few. And today we have a few dozen AI-driven care pathways, but I'll try and pick like diverse ones. So one of the ones I find most interesting is for incidental findings. That's actually a really big value proposition for AI because AI is not as biased as human, so it can always scan. So there is a disease called, I'm sure you know this, but like pulmonary embolism, which is very important. But the problem is that oftentimes it's unexpected. So you can have no clinical symptoms. And the value of AI is that AI can detect it on an image, even if, by the way, it's like an abdomen chest, right? So you're really not expecting it. And it can look in your chest and identify signs of pulmonary embolism. And the value of AI is then it can take it off a list of 100 patients waiting for diagnosis and put it at the top of the list, say, hey, we have actually a patient with pulmonary embolism. And then they can take the patient to get treated right away. So to give you an example, University of Miami, what they did, they actually implemented this in their outpatient workflow because they have a lot of cancer patients, and cancer patients have higher chance of pulmonary embolism. So the workflow they have is basically patient coming in, they scan and see, does the patient have pulmonary embolism? If they do, they get triage, radiology reads the exam right away. If then they have a finding, the radiology confirms, they take the patient by the hand to the ED. And we actually had cases where the patient got admitted and then got a thrombectomy because the PE was that severe. Nobody expected it. With the backlogs we have now in healthcare, we have outpatient backlogs of sometimes 2 to 4 weeks. Imagine a patient with a severe enough PE to get a thrombectomy that is waiting to be read for 4 weeks, right? So that's one example. See any questions on that or comments?
No, it's a great example. And I mean, I think for listeners that aren't in healthcare, like a thrombectomy is when you actually go into the lung, through the vasculature and you're taking out that clot, which normally doesn't happen. That is like what you just said, that's a severe form of a pulmonary embolism or clot in the lungs. That's a good example. I mean that, and I mean, we love examples on here. So if you have any others to share too, I love the, kind of the other kind of customer examples that just illustrate, the simple kind of value prop of, I guess, could you give some of the examples around any that are, outside of the radiology space? I know you started there, but I know you guys have delved into other specialties as well.
Yeah, so I'll give it. So I'll take as an example aortic aneurysm. So another important cardiovascular disease, and the problem is that sometimes even if you identify that finding, so apparently for those outside of healthcare it might sound bizarre, but even if somebody found the finding, there is a very high chance nobody would follow up with you on that finding. And in fact, the typical data we see is that 50% of like findings, like incidental findings or recommendations, do not get followed up within the system. 50%. 50. So basically the opportunity of AI is to find that finding, but then not just flag it to the physician that is, let's say in radiology would review the exam, but actually flag it to vascular surgery department. So that's a whole different section. They don't even know you exist, and tell them, hey, we actually have a patient you may want to take a look at. And that, in my mind, is shifting the whole experience of a patient, right? Because you're not just looking for what you have, and you're looking for a physician that is searching for a specific thing. If there is something else, we want to flag it to whoever needs to give you that care. And there is a lot of opportunity in that use case, and I can give many examples. But for aortic aneurysm, we have some recent data from Yale. So Yale has one of the best aorta programs in the nation, so they treat the aortic aneurysm really well. But they found out they have massive leakage, that even if a patient came in and there was an aortic aneurysm identified, the relevant department, vascular surgery, didn't hear about the patient at all, and therefore they had significant leakage. So patient that they told them, just to give you an example, think about you coming in and doing lung cancer screening or or coming in the ED because you have whatever shortness of breath or broke a rib, and they look at your image and see an aortic aneurysm, but then nobody does anything with it. You just know you have an aortic aneurysm, which is very important because it can rupture and then kill you. So basically what Yale did is said, oh, now I want to have AI flagging and alerting me in a different department that we have these patients. They were able to increase their follow-up rate for aortic aneurysm by 130%. Not 30%, I want to be clear, 130%. That is like over double the number of follow-ups. And that shows us how many care gaps there are in healthcare because of this care coordination, patient falling between our cracks, and the opportunity for AI to be this massive connecting force.